Greetings, PsychU community. Rachel Self here from the Otsuka Neuroscience Medical Affairs team. As many of you are aware, May has been recognized and celebrated as Mental Health Awareness Month within the United States since 1949. PsychU would like to join in the celebration and awareness efforts by hearing from many of our contributors and collaborators. Today, I am pleased to be joined by Dr. Tara McKinley, pharmacist and managed market liaison for Otsuka Field Medical Affairs, and just an all-around lovely lady. Thank you, Tara, for joining us today.
Thank you, Rachel.
So let's dive right in and hear from you about what May Mental Health Awareness Month means to you.
Sure. So to me, I look at May Mental Health Awareness Month as really a time to bring light to those that are continuing to struggle with mental health, but just for so many people, I look at it as an opportunity to really break down the stigma that's all too often associated with mental illness, and really an opportunity to share stories, educate those around you, and most of all, celebrate the patients, the caregivers, the providers that are battling mental health, treating mental health, and really just celebrate the patients and bring light to mental health and in a positive way. Additionally, I'd say there's a lot of walks that are going on and being supported by advocacy organizations across the country throughout the year as well, but really May, it's such a beautiful month typically with the weather, and so I think it's a great time to participate those and surround yourself with those with like minds.
That's a great point. Yeah, and thank you for highlighting some of our walks. Maybe we can start to incorporate some nice mental health awareness picnics in the future as well.
There we go. Great idea. I'll take it.
Yeah, get out there in the nice weather. So, so that's actually a perfect example to segue into the next question I had for you, which are, just some things that people can do to help raise awareness. And to kind of piggyback on that a little bit, what are some key things that you wish the general public was more aware of regarding mental health?
Yeah, I mean, just the prevalence. I mean, it's kind of shocking. Like roughly 1 in 5 people struggle with mental illness in a given year. And that's just in that year. It fluctuates, of course, for some people, but realizing that, even if you're not talking about it, or maybe you don't know about your fellow coworker or even a family member, but there's so many people affected by mental illness that, and that's why I say having conversations about it and normalizing speaking about mental health, I think is a great opportunity because so many people are affected by it. Even, in the schools, I think that's being incorporated more now. Caregivers, coworkers, and so just really finding ways to integrate discussions about mental health will make it easier for those that are in need to feel more comfortable and knowledgeable about when and how to seek help. And so again, just the normalization about talking about it, just like any other disease that happens or illness that comes across, I think we can do that with mental health.
That's a great point. Absolutely agree. Yes, take away the shame and have a level of comfort in discussing where everyone's at. We all have our individual struggles. So along the same lines, but shifting gears a little bit, and perhaps maybe drawing from some of your expertise in the managed market access space, what are some things that you wish healthcare providers themselves were more aware of regarding mental health?
Sure. Yeah. So, in my intro, you mentioned I'm a managed market liaison. So what that means is I'm on the medical affairs side of our organization, also as a pharmacist. So my primary role is to share education, both on our products, but also really around disease state, health economics to insurers and payers. So what's important to realize here is that a lot of the larger organizations, they have specialists, they have departments that focus on behavioral health, even employ psychiatrists and whatnot, but there are certain areas in these organizations that don't have those specialists, or some of the smaller organizations and payers they have to be generalists. They have to provide access to care for all disease states, really. So with that brings a fantastic opportunity for us and others to provide education, to share, awareness about mental health and those opportunities. And One of those I would say is that I like to sometimes give a comparison just for those that really are jumping into mental health, is that, treating our brains is not like treating a simple infection. You don't just say, take this medication for 14 days and symptoms should resolve. It's the patients, their responses to medications and therapies and everything, they're so heterogeneous. And so, if someone's diagnosed with like bipolar disorder, you don't just say, oh, yep, I know exactly which one. You have to consider so much when treating patients, and therefore allowing open access, I think from like the payer side becomes really important, so that providers do have the opportunity to take into consideration side effect profiles of medications, access to providers. So do they need telehealth? Is transportation needed? Taking all of these things into account so that we can treat the individual successfully, both pharmacologically and non-pharmacologically. And then the last thing I'll throw in there is just to say that for providers, I think empowering patients and providing that education early on about all opportunities for treatment is important. So really just opening the door. I know a lot of times providers, can just say, okay, we're going to prescribe you this one medication. Well, if the patient hits a wall there and says, this didn't feel like it's working for me, they may not realize how many different options there really can be for patients. So I think providing education both to the patient, the families early on, and sources of information can be really key to make sure patients have successful long-term treatment, as mental illness typically is so chronic.
Thank you so much, Tara. Yeah, you definitely bring up some great points. We are very complex, dynamic human beings. We need comprehensive approaches, all hands on deck, right? So thank you so much for bringing
Yep.
that up and for sharing some of your thoughts today with us to celebrate Mental Health Awareness Month in the month of May. But hopefully we will extend that throughout the rest of the year. We appreciate your time with us. We appreciate the PsychU community. And with that, we'll hope everyone has a fantastic rest of the day. And please continue to join with us as a community to improve mental health care and mental health care awareness together. Thank you all so much.
Thank you.